Hello and welcome to our Friday webinar. We're back on today with Dr. Tom Tully with Ask the Vet. Welcome, Tom.
Well, good to be back. Good to be
It's
back.
nice to see you. We missed you last month, but
well, I had my Halloween paraphernalia, my gear ready to go, but we'll save that for 2023.
there we go. Big reveal gonna happen then. And then wow, we're already heading straight into the Thanksgiving season and then the Christmas season. So it's just once we hit October, it just seems like it's just boom, 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 right?
It's like the sun setting, it takes all day to
Yes.
get to the horizon. And then if you watch the sunset, whoop, it goes really quick. So that's the year, it's all year, and then it gets to October, then whoop, goes really quick.
So in your area, are you one of the clock movers? So you guys fall back, or you?
Yes, we do. Just so we know how to change all the clocks back and forward in the spring.
That's right.
And it doesn't appear that it's stopping anytime soon, from what I'm to understand. So.
Do you notice a difference in your birds with that at all?
No, I mean, this time of year, just naturally, with the shorter days, especially with chickens, we have a lot of people with backyard chickens, and they stop laying at this time of year. And anybody, of course, with canaries, they're singing and they are beautiful at this time of year. So
why is that? Why are they is it
the canaries singing? And
when it gets darker earlier? Or
yes, it's because of the shorter days, and this is the canary breeding season in the winter, and of course they have the canary shows at this time of year, because they're in their full beautiful plumage. And as the days get longer, the canaries stop singing because they start molting in the longer days as it goes in from late spring into summer, and they are not beautiful as the new feathers come in. And then of course you wouldn't want to breed and try to find a mate when you looked your worst, right? So why sing if that's all happening? And so you just wait till you get on your beautiful attire in the fall and start singing at that time to get a mate and breed. So
that's hilarious. They're like, wait, I'm looking really good right now, so I better let everyone know.
Exactly. That's the whole point. So when we have people that are concerned about their canaries not singing in May, they've been singing all, since I purchased them in December, and then all of a sudden they stop singing. Well, we have a good idea. And I mean, that's not it all the time, but for the most part, that's the most common reason.
Wow.
Yeah. Okay. There you go. Always something interesting in the bird world.
That is fascinating. Yeah. I would. Yeah, you'd think that the shorter days would be like less time to show off their beautiful plumage, but they know how to take advantage of the day, like the time.
Exactly. That's when they're getting all their new feathers in. So although they don't go like, well, we have to, fall back and spring ahead. They do have to. Actually, their seasonal biorhythm is affected by the longer and shorter length of the daylight hours.
Okay.
Mm-hmm.
All right. There we go. We learned something about canaries. That's awesome. I didn't know any of that, so thank you. So speaking of learning things I don't know, we got, I'm sure, some awesome questions that for today, and I'll probably learn even more. I can't wait. Here we go. Just a reminder, use the Q&A button before we, if you have a question for Dr. Tully. And are you ready for the first one out the gate here?
Yeah, let's see what we we'll all learn. We all
Okay.
learn from this. Yeah.
So this one is from Tony. This is we have a 2-year-old cockatiel who was purchased as a male but lays eggs. So uh
I
Bilbo.
had one of those. I had one of those. Yeah.
Like the
Mhm. Yeah, 8 years. I thought it was a male. But I had mostly females, and it took and then about the 8th year it was a non-dimorphic mutation where you couldn't tell the male from the female, but received it from a cockatiel breeder who said it was a male. And looking back on it, when I did get a male, it was definitely a female. Males are much more vocal than a female is. The females can be vocal, but on a very, very lower magnitude than the males. You can't, males are just like going all the time. But anyway, it
All
was
right.
7 years in, and I had the first egg, and it was like, wow, you're not a male. So I've been there. I know.
Whoa, okay. Well, they had theirs for 2 years, and then okay. So Bilbo laid 2 clutches this year, and they've been careful with her diet, plus covering her for longer periods and moving her cage around into different rooms. However, she has now started making signs that she wants to lay eggs again. So what advice do you have? Can you offer any advice as we're concerned it's the wrong time of year, being winter here, plus the toll on her health? So how do we discourage Bilbo from laying more eggs?
Well, that's going to be difficult. That is going to be difficult to discourage Bilbo from laying eggs. One, while I was just talking about canaries and having a kind of a breeding season, it's really in cockatiels and other parrot species, if you will, cockatoo species. There is no egg laying season. We do have a tendency to see that with Amazon parrots, where they'll lay in the spring primarily, but with African grays, macaws, people who are on this this webinar can attest that they'll lay year round. So they're not going to have an effect on their biorhythms with the sun daylight length. And so there's really not for the cockatiel, there's not a bad time to lay eggs if the body's actually producing eggs, and it's the right time to lay eggs. Although it's a single bird, obviously, and I say obviously, but some people, I've had questions about single birds being in the cage and wondering if it is fertile or not. If it's a single bird in the cage, unless there's divine intervention, it will be non-fertile. So you don't have to worry about incubating it, or that that it's a viable egg. It's not. It's like your chicken eggs that you buy in the store. So in the bird, you're taking good care of the bird, obviously, and you're feeding it well, and it's happy in its home, and so everything's taken care of, and so the body's just responding, and it's producing eggs. So it's hard to discourage that from laying eggs. There's one thing that you always want to make sure you have a calcium supplementation in the cage in the form of a mineral block or a cuttle bone, to make sure that bird is getting enough calcium in laying eggs. There's the question of, do I remove the eggs? And if I remove the eggs, then the bird will lay the eggs, because that's something that people tend to do, or it's an option for people who want to produce more eggs and are artificially incubating or setting these eggs under another bird or chickens or another parrot, that they would double clutch, called double clutching, where the bird will lay a clutch and you remove the eggs and it's like, oop, where did the eggs go? I guess I better lay some more. And so you get more production by double clutching, but you have to be able to incubate that first clutch if you're going to try to get the chicks out of that, the most out of that, the double clutch. So that's kind of the theory, that if you remove the eggs, the bird will continue to lay. I think that there's no regulatory mechanism in cockatiels. That's just a personal opinion, that whether you remove the eggs or you keep the eggs in there, the next thing you know, you have 50 eggs in there. There's nothing that really, with a cockatiel such as this, they just continue to lay. And then you have the situation, you have the eggs in there and they're not fertile, they're older. What's happening to this egg that's in the environment that's not actually forming a chick? It can get rotten. So I don't, with my birds, my cockatiels, when they lay eggs, I pulled them out. I wanted to try to discourage the bird from laying. And I think that whether you remove them or whether you don't, they're still going to lay if they are in a very good environment and getting good nutrition and good calcium supplementation, because they just are programmed that way. So you say, well, what's the consequences? Well, the consequences of something like that, well, if they're laying so many eggs, that increases the odds of a problem with the egg being laid, dystocia, egg binding. And so the bird can't lay the egg because, 150 eggs came out fine, but whoops, this one was a little too big, this one didn't make it, what have you. And so that could happen. So that's one of the concerns. And if it happens once, then it's likely to happen again. We see repeat offenders in this problem. So with that in mind, it's doing fine. I don't do anything. I just make sure that it's getting the proper nutrition and supplementation, and it just goes naturally. And I either leave the eggs in there or remove them. It's still going to lay the eggs. So what can I do if I want to do something? Well, there's the deslorelin implant that you can place under the skin, and this deslorelin implant works through the hormone to reduce the egg laying hormone in the birds, just to kind of to put it in just a kind of simplistic terms. And so it reduces the ovulation and reduces the chance of the bird laying eggs. And so most of the time when we place this in a bird, and it's about the size of a Tic Tac, a little breath mint. And so, or if you're familiar with the size of a normal microchip in a dog or a bird, not the mini microchips, the regular size microchips, that's about the size of this implant. So it is rather large in relation to the size of the cockatiel, but the cockatiels we don't have any issues placing those under the skin between the wings and the back. This will be effective for, it could, normally what we're seeing is 3 to 6 months. and these aren't cheap. They are on average $250 to $300 for the implant, and to apply that implant under the skin. But it'll last 3 to 6 months. It may last longer, could last a shorter period of time, but it seems to be effective based on our observation and use within our clinic, and what I've heard from other veterinarians. And then you say, well, how, in each bird, it could be different on how much you do. It could be different on how the bird reacts to the implant, meaning you may need to look at getting it replaced in 3 months. You may need to get it replaced in a year. And so you say, well, how do I know when it needs to be replaced? You need to, that is fairly, to me, you have to be aware of your bird and kind of know its behaviors. But most cockatiels have specific behaviors that they go through when they are going to lay an egg. One is vocalization. They'll have a change in vocalization, and the females will. And then also what the females will have a tendency to do is, if you have newspaper at the bottom of the cage, they'll have a tendency to chew it up in little bitty pieces. And that is both indications that, oh, I'm feeling like I'm going to lay an egg and I need to make something, and I want to, and I just feel like this vocalization is what I should be doing. And so it's kind of a telltale sign of egg laying. If the birds start doing that, then it's time for an implant. And so that's an option to try to reduce the egg laying. The other is if the bird, if you want to go into a surgical procedure, you can remove the oviduct. It's called a salpingo-hysterectomy. And that is, of course, major surgery. You're going into the body, and you are going and removing the oviduct. It is a surgery that is very known, and it's been performed by a number of avian veterinarians. But you'd have to have somebody to do that surgery to remove the oviduct. And by removing the oviduct, you're not removing the ovaries, just the oviduct. And there is a slight possibility, probably a 5 to 10% chance at most, that the bird will still ovulate, and then that's a whole nother issue. But there's about a 90% chance, that 95% chance that once you remove the ovary, the bird will not ovulate and not egg lay. So you're removing the reproductive tract surgically. And of course, therein lies inherent risk when you do a major surgery in the body cavity like that. So that's one way you can stop it. So excellent question. And there's many facets, as most of the questions that you asked have, but this is a common problem that in cockatiels are what I would consider the first bird that any hand-raised cockatiel is perfect for the first bird that anybody owns. Wonderful birds, but the females do have this problem. And this is something, I'm using the cockatiel because it was a bird of question, but this is the same recommendations that we have for other birds that are chronic egg layers, that people say, I want to stop laying eggs, or the bird comes in and has an egg binding situation, but it's the same medical advice across species.
Okay.
There you go.
And so the part about trying to relocate the cage to different areas? Do you think that's can be
Well,
effective?
that is, it's one of those things that is a good thought. And people have said, well, we can reduce lighting. And lighting will have an effect. I don't see that happening so much in parrots, where parrot species, whereas I mentioned chickens or canaries. There's birds that where the day lengths, the daylight hours, shorter or longer, have an effect. Usually, if they're shorter in chickens, like I said, and some birds, they're not going to lay, and in canaries, it's just the opposite. But it doesn't appear to have that much of an effect on birds. And so you say, well, why moving it around the house and everything, is that going to do it? Maybe stop at egg laying. Well, one of the conditions that I've always kind of followed as it relates to getting parrots to be reproductively active, laying eggs, raising birds, the little chicks, is that the birds have to become comfortable within a surrounding. They have to feel secure. They have to know that they're going to have food, get all of the really requirements of life checked off before we reach reproductive activity. Now we can fool around. I can eat, I'm safe, I'm happy, now I can have some fun. Okay. And so we can reproduce. And so if you follow that thought process, then if you're in the same spot, you're comfortable in that spot, that you're happy in that spot, then that means that I'm not really worried about much. And so then I'm more comfortable. And so the thought of moving the bird around, kind of like, well, whoa, like, what's this? I'm not used to this. This is new. So then theoretically that should kind of get the bird not thinking about I'm not really concerned about laying eggs right now. I'm just worried about making sure I'm okay, you see? So you're kind of behaviorally affecting the bird's, hormonal activity, because it's kind of diverted into thinking about its surroundings. And so that's kind of the theory behind that. And it may work. But cockatiels, I'm telling you, when they start feeling comfortable within an environment, it's tough to do. It's tough. It may work for other birds, and I'm not saying don't try it, but for cockatiels, it would be tough to do. And then on the opposite, African grays. You have these African grays, you have 2 African grays, you have 4 or 5 pairs of African grays. They're laying, and every year, oh man, this is great. All of a sudden they stop laying. And you're going like, well, it's been 2 years now. I don't have any grays. What's wrong? What's the first thing people say when birds stop laying? What's the first reason birds stop laying? For my experience, it's been, oh, Dr. Tully, it's the weather. The weather has been too dry, too wet, too hot, too cold, too windy. I don't know what it is, but it's the weather. And so it's not always the weather. And with African grays, it's just the opposite of what I was saying, where if the African grays are not laying, and they have been laying, or they've been known to lay and they are not laying, well, in my experience, moving those grays to a different location. People have driven them around in their cars and moving them to a different location. For some reason, a new location stimulates African grays to lay eggs, and which is kind of, opposite of what we were talking about for other parrots. But that's just kind of answering the question about moving around. Well, some birds, and what my understanding and my thoughts and observations have been over the years of either keeping the birds in one place, moving them around. And there's, as we talked about, the different species, there's different reactions to that. I've known people that have had 6-7 pair of beautiful African grays and say, I've been feeding them for 2-3 years, and oh my God, they're not laying. I'm just throwing money down a hole. They sell them. Next thing you know, in 2 to 3 months, everybody's calling them back and saying, "Thank you so much. My great, your grays you sold me are on eggs."
Yeah.
It's like, oh my goodness. So anyway,
when you're describing you put them in a car, I'm just imagining you hiring some thugs to like a windowless van, throw the grays in the back, put hoods on them, don't know where they're going. They're gonna arrive somewhere and want to lay eggs.
Make it exciting.
Right. Like a spy movie there.
Yeah, exactly. So anyway, so hopefully that helps a little bit.
All right, that was good answers. I got another cockatiel question for you. This one is from Bonnie, who has another 2-year-old cockatiel that is clipped, got his wings, feathers trimmed. The last time
How old is it? How old?
2 years old.
2 years old. Okay.
So,
2-year-old cockatiel day.
Yep, another 2-year cockatiel. The last time they clipped too short, so from now on they're only going to the vet to do this, right? Anyways, they're saying that only flight feathers on one side now. So the blood work, the blood work shows the baseline to be fine. So they want to know the reason why they'd only have flight feathers on one side. They say that he's molting now, so hopefully they will come in. The diet is tops. So what would they have the pellets, mash, sprouts, veggies? Could a bad feather trim really like make the feathers grow in unevenly like that?
Well, a couple of things. So the feathers were cut too short, and I always in what I teach is as far as so the question is what's too long and what's too short. Okay, and if you ask people, you could ask 10 people and they'll give you 10 different answers. I teach we trim our feathers to just below the level of the dorsal covert feathers. And those are the dorsal feathers over the primaries, the kind of the second layer of feathers. So when the birds, and just below it, so you don't see them when the cut feathers when the bird has its wings back. So it looks aesthetically pleasing, and we found over 35 years that it's not too short. But you don't want to trim them any shorter. But even if they are trimmed shorter, unless they're trimmed at the level of the follicle, then they should come out, and when the new feather's developing. Now, what's interesting about birds, parrots in particular, not birds, but parrots, cockatiels, if you have, say you have 10 primary flight feathers on, and that's usually the number of feathers, the last 10 on each wing. We trim both wings. It's a bilateral, the feathers on both wings. We don't trim one side, because then the bird has less control over, it has more control over one side and can actually injure itself. I think has a greater chance of doing that because of its inability to control its flight by flapping one and having the flight ability in one and more than the other. But with that said, that's the 10 feathers on each side. And when you're looking at trimming those feathers, we always look for blood feathers, and these blood feathers are what all feathers are, blood feathers, because they have to develop and they grow. And what is, so you say, well, what about the little feathers? Are they blood feathers? That's what a little pin feather is. A pin feather is a blood feather. Okay, it's just a little feather. Okay, and so the primary flights, secondary flight feathers, and the tail feathers, of course, are the big feathers. So they're more obvious to be blood feathers as they develop. But you can see the little pin feathers, but they're just little bitty feathers that are blood feathers. That's the developing feather. Now, when we look for those on parrots and cockatoos and cockatiels, and what they will do is that you will have uneven molting on these flight feathers. And you say, well, why do they have uneven molting? Because there's some species that molt all of their flight feathers at one time. And guess what happens when they molt all of their flight feathers at one time? They can't fly. And some duck species and waterfowl species, this does occur just prior to migration, because they want to have all of their good feathers when they migrate, right? So just prior to migration, when they molt, they have they can't really fly. They can get around and kind of hover and go around, but they can't get lift and of any circumstance, and they're vulnerable at that time. At no time can parrots be in that situation. And so how do they molt their flight feathers and still be able to fly? Well, what's interesting is if anybody's looked at the feathers on the wings of parrots, what you'll notice is most of the time, if the fourth primary flight feather is molting on one side, the fourth primary flight feather is molting on the other. So that's why you're going to have irregularity in the growth of your flight feathers during molting. And it'll be more noticeable when the feathers are trimmed, because those feathers will come in irregular on the shortened feathers, and you can see the longer ones coming. You say, well, gosh, you got one on this side and one on, and so they're not going to all come in at one time. And of course, they're not going to grow back until they molt. So you'll have to wait until they molt and that may take 6 months to a year for that to occur, or maybe a little bit longer. But so that's why you're seeing some irregularity. They'll come back, but it's going to take a little time. So hopefully that's helpful.
That is helpful. It's a lot going on with those feathers. If you think about how important feathers are to a bird, it's it's not kind of like our hair like coming and going. It's No. Those feathers are like, I need protection from the elements. I need to keep warm. I need to escape.
I need to go get some food.
Yeah.
I
Or
like
in the
to
case
get
of the
in there,
canary, I need to attract some mate. So it's all over.
wave at the macaw going by you on the freeway, right?
There you go. There
Hey,
you
I'm gonna go get some Lafeber pellets down there, you know,
go.
down
Oh my
at the
goodness.
drive-in.
Yes. Well, we actually have our next question is a macaw question. From Stephen, they said that they're dealing. They want to know if they're experiencing. They're dealing with the ligament damage in birds. So here's the background. The store that they shop at has a blue and gold macaw who suffered damage to the joint in one of his legs during an accident. And the diagnosis, the X-rays show a separation of the knee joint between the femur and the tibia. I guess from what you can tell that they're not connected anymore. So before they went to an avian vet for x-rays, they gave him time to see if the lameness would mend itself. Like they gave about 2 weeks. During the initial consult, the vet said they had left it too long and that in cases like this, the ligament dries out when it's detached for that long and can't be repaired. What are your thoughts on that? Is that bird, can that area be helped?
Well, the do we get nothing but good questions?
That's a really good question. I mean,
Anytime people ask questions, I mean, all of these cases go through my mind, like we did, this case, that case. And so this is an excellent question because this is called a stifle luxation or a knee luxation or, dislocation of the knee. Okay. This is like an athlete that has I guess the most severe anterior cruciate and just a total dislocation of the knee.
so is this the football player being carted off the field on the cart?
Yes, carted off the field, and the top, the femur goes one way, and the tibia goes the other way. Boop, just separation. So you have separation, total separation. So you have all the ligaments gone, your joint capsule's gone, and the bones aren't in the same room. So if you do nothing, the bird would learn to accommodate. But that's an option, doing nothing. You can say, well, what if we what if we put it in a split? Let's put it in a split and we get it right together again and keep it in there for about, a month and a half, 2 months, and then it'll stay. Take the splint off, boom. Because there's nothing holding it. There's no, the muscles are, you still have all of the tension there, but there's nothing holding that joint together or the bones together. There were ligaments, there was a joint capsule, that was all torn. So you can splint it all you want, put it in place. The minute you take that off, it'll separate. So that really doesn't work. And so then what you're looking at is the length of time that the joint is apart. There can be some changes in the muscle tension or what have you, because it's not in place as it should be, keeping the tendons, the muscles, and the ligaments all stretched as they should be. So they have, if there's not that tension on them, they do have a tendency to contract. there's not a fracture. So it's not quite as bad as if you had a fracture and then the muscles are stretched and then they contract because the bone isn't keeping them separated. So the bones are in place, and so you're not having that much of a difficulty over time with that. So there is some validity, I think, with what the questioner's veterinarian had to say, but I do feel that splitting doesn't work. The bird can adapt, but it will be somewhat a special needs bird for the rest of its life, but can still have a relatively good quality of life as it is. And it's going to be dependent on how the leg is and what the bird is able to adapt with the leg as being out of joint, so to speak. And like I said, when you're talking about out of joint, you're talking a significance there. So we've had macaws come in like this. We've had cockatoos come in like this. We've had conures. This is not an uncommon presentation, as you can imagine. The legs getting caught, somebody, different reasons, you name it. This is something that we see. So what have we done? There are surgeries. We did some research to actually find the joint angle, what the joint angle, correct joint angle on perching birds were. Some parrot species, owls, Hispaniola and Amazon parrots. I think we may have had some cockatiels in there, to find what the joint angle is. So if somebody wanted to go in and what we call arthrodese, ankylose, to make it a frozen joint, and you can do something to make it a frozen joint, and it's almost like breaking the very ends of the bone and putting those together to actually heal the tibia and the femur together. And and so you can do that as a surgery. It is major surgery, and there are complications when you do something like that. You're opening up that joint, and if anybody is familiar with the little knees of birds, that there's not a lot of room in there, and there's blood vessels and nerves, so you can have nerve damage. And after the surgery, the surgery, get it together, and then there's no blood supply to the end of the leg. If you do that surgery. And then also we've had surgeons. Now we're talking about you're looking for a veterinary surgeon that's comfortable with treating and doing surgery on a bird, because a board certified surgeon is probably somebody that would be able to do this, and really that's the only ones that I feel comfortable doing surgeries such as this. And we have had birds that we've had here. I had a picture of a macaw that we did this surgery on, and they will go and put the joint back together with putting a hole in really the tibia, and also in part of the femur, and actually tying the bones together with the suture. And so there's been probably, and we've published at least 2 articles on this particular problem of the stifle joint luxation on surgical procedures that we found to be successful. And of course, the bigger bird you have, the more anatomy you have to work with. So you have a bigger bone. And so we have, so there are examples of surgeries that can be done to try to get these bones back together. And going in surgically, whether you actually make a frozen joint where the bird can't move it, but it's together and it's in the right perching angle, and it can get, and it's in the right position, or whether you actually put the joint back together with suture and make it a mobile joint. That has to be, again, surgery going in intra-articular, where you have to make an incision and go into that. So that's the choices that you have. But then, and any of those I think are acceptable with the bird that you have. I don't think it's too late to do anything if you want to try to actually resolve this, or try to treat it. And then you'd have to talk to the surgeon or the veterinarian that would be doing this to go over what the, with that particular case, with what's there, what the the chances for success, and what the possible limitations are, and possible problems that may occur. But there you go. Stifle luxation in a nutshell.
I'm glad I didn't have to spell that. So just really quick, people are sometimes surprised by where the bird's knees are actually located, because the assumption is it's on lower, like, isn't it? You can't really, when you look at a bird where their knees are, right? It's not where people might think they are, from what right. Oh, here we go. Sorry, we got our anatomy here.
Here's little Ray. Okay. And so I have little Ray right here. And so this is little Ray. Little Ray's a parrot. Okay.
Probably needs to eat a little bit.
Yes. He was scared at Halloween. Now, so right here, if you can envision little Ray perching. So here you have the femur, and here is the knee right here. That's the stifle or the knee. That's our knee right there. That's the little bird's knee. Now, what you're going to see is what's really difficult for people is that with this knee being in this location, this is the thigh of the bird. This is the drumstick right here. All right. Now, this is the body right down here. You see this right here? That's the body. And so the knee is right as the body ends going down, you see? So see, this is the keel right here. So you have the keel. This would be his little belly, and then going all the way up to the tail. And so you see where the knee is?
Yeah. And
that's why most people think the knee is the hip. The knee isn't the hip if you're just looking at it. The knee is the difference between the thigh, because the thigh, and that's what makes it difficult to treat femoral fractures in birds, because this is all up against the body. That's why, our femur is like down below our torso, right? our hips, and then it goes, we have this long femur. Well, the birds have a long femur, but it's all on the side of the body. Okay, where the thigh is. That's the thigh of the bird. Okay, and a chicken. All right, and in a parrot. And so then you have the tibia tarsus right here. And this is where the knee is. And then down here is the ankle of the bird. Okay. And this is the foot of the bird right here. And guess what the bird stands on? The ball of its feet and its toes.
Not the back.
Okay. So a bird isn't standing on its foot, except the ball of the foot. It's just like if you stood on your tiptoes on the ball of your feet all the time. That is how a bird and many animals actually stand. They don't walk on their whole. That would be for analogous to a human. The birds would be walking around on this right here. That's what they would be standing on the perch, you see. Yeah. So hopefully that helps kind of put everything into perspective.
Yeah.
As it relates to the hip, the knee, the ankle, and the foot. The ankle is right here.
There's a longer distance between their knee and ankle than ours. The perspective is.
Relatively. Yeah. Oh yes. Mm-hmm. Very much so. Yeah. So there you go.
Break him out more often. That's a really little handy guy you got there.
Well, I've got all kinds of things. You never know. What I could pull out of the hat.
Do show and tell someday. So we have a question from Karen about a 30-year-old red belly parrot that's had a small 2-millimeter growth between the beak and the eye for like years, but in the past 4 weeks it's grown to like a centimeter. He seems fine except for it's getting a bit larger. And is scheduled for an aspiration, but whichever it is, benign or cancer, have you known them to be removed or treated successfully? Would you put him through surgery at his age? He's 30 years old. Got a growth?
So it's a growth between the eye and the nares, right?
The beak, yeah, the nares.
The beak and yeah. And it's been there for years, right? She said.
Yes.
And
it's recently started to grow.
It recently started to grow. And it's a 30-year-old
red belly.
Mm-hmm. The one thing, red belly, you said?
Yes.
So I would say that that I don't think it's too old for surgery. No, I don't think it's too old for surgery. But I mean, I don't. Meeting the risk is not going to be any more or less, I think, than say any other. Unless I'd have to do a physical exam, but if all things are fine, I don't think it's going to be any more or less than any surgery. And like I said, when you do a surgery with general anesthesia, there's no such thing as minor surgery. That goes for humans too. But I'm just thinking of a recent case, but it involved, and then there was also a case on African grays where there were some different growths on the above the eyes that were associated with really bone, the bird, say the bird was hitting its head or had stimulated bone growth, and it was just bony proliferations, like little horns coming out of its head because it was hitting its head. That would be my most likely reasoning behind that occurring. Some of these growths can be little proliferative lesions, epithelial lesions. If it's been there that long, I wouldn't think it would be like a neoplastic or cancerous, but you can never rule that out. There could be something that's a little abscess on that. This would be kind of something that is, if depending on, again, you said it's 2 millimeters in diameter. That's in that area, that's, very noticeable. One of the things that you can do is it's still of a size that it's possible if it's growing that you can almost take a quick incision and remove it. And I mean, you'd almost only the 2 sutures at the most would close that up. You could get a biopsy on it and see what it is, and then you would know. And then for the most part, that's what we call an excisional biopsy. And I think that would be probably more beneficial than doing a needle aspirate, where you put the needle in there and you aspirate the material and see what the cells are. And you can tell whether it's an abscess or a fatty tumor, or kind of a hematoma if you get blood. That still may be possible. I'd have to see it. But it's kind of interesting. It's not to say that you could have somewhat of an inspissated abscess. Well, bird blood, the white blood cells, they, instead of forming liquid purulent material or something we commonly call pus, that it kind of coagulates. It's kind of what we call inspissated, and it kind of hardens, and so they don't have like a liquid flowing purulent material, but you just make an incision and you can pop it out, which is very convenient with birds. Sometimes I'm going in looking for the little purulent material, little seed or bead or larger of purulent material, and find that it's not that, and it doesn't pop out, and that it is more tissue involved, or like this last one not too long ago, it was bony proliferation on this bird, thinking it was maybe a little abscess. But that was on the dorsal surface where you could see. I don't think it's been here years. It's it's either some cellular hyperplasia, meaning the cells, there's kind of an accelerated growth to the cells. It's not necessarily cancer, but it's just accelerated growth of cells in this area, or it was a smaller abscess that stayed there just under the skin for this long, and then something has stimulated some more formation to that. So those are the possibilities, and I think that you can see if it's an abscess. Sometimes it'll move under the skin, and so they can kind of feel it and see if it moves under the skin, or if it moves with the skin. That means it's more infiltrative within that skin. And if it's more infiltrative, then probably with the size, you can just make really a quick incision and remove it, get a biopsy, and it's an excisional biopsy. So hopefully with the results that nothing else occurs, but it'll be gone, and then that should heal, and then you don't have to worry about it.
Wow. All right, there we go. I think that's the time we have for today with our questions. That went to a, gosh, it goes by fast. Believe it or not, we're already at our hour. But if we didn't
We just started.
I know, right? We're just getting this thing started. Yeah. So, well, we had some makeup times because we had, I'm sure we had some questions for the last one. So we are, well, here's the thing. So we didn't get to your question today. We'll try to get the email answers out to you, but just be, be patient because the holidays are rolling around. So, so we do have some questions that maybe we'll even save for, like, go through them and save one for the next one, because there's so many good ones. Oh my goodness. Yeah, this is
and then hopefully too, Laura, even though we may not get to somebody's question, we thank you for attending, and that hopefully by other people's questions that you learn, that you can learn more about the birds that you care so much about. So we all learn, and I'm happy y'all are here, and we learn from each other.
Absolutely. I mean, even I'm obviously maybe people that tune in, they don't have a question because you don't even know, like, people answer questions that you didn't even know that you might pertain to your bird. There's like so much learning that you can do just from other people's situations. So there we go. Now we all know now everyone's really clear on where the knee is and where the hip is. And I mean, it's
it's it's
things.
good to know. Yeah.
All right. So I'm gonna announce our giveaway winner. We do have one today. And that's going to be the foraging product, the foraging fun pack, as well as another Lafeber product of your bird's choice. That's going out to Alice Gregory. Congratulations. Hope that makes your bird's weekend some nice feasting heading into the Thanksgiving holiday. There we go. Also, I'm going to give so this was our last one for November because we got the holidays coming up, busy time of the year. So we're going to be back December 2nd with Dr. Lamb. She's going to do a respiratory disease in pet birds. That's with Dr. Lamb. We have a special time at 11 a.m. An hour earlier, so 11 a.m. Pacific Standard Time. And then, December 9th, we've got our holiday pet bird holiday gift guide and giveaway. So that was a huge hit last year. Yeah. So we're going to be giving away some free product. Oh my goodness. Yeah, there we go. So that alone is reason to tune in. Get some extra special funness under the tree for your bird this year. Tune in next, the 9th for that one. So there we go. Dr. Tully, it's always a pleasure to have you on, and just learn every week that you're on, not only new words and pronunciations, but answers to things I did not know. So
well, I'm still working on them too, Laura. I'm telling you. But anyway, yes, thank you so much. Thank Brenda and Lafeber for and most of all, thank all of the attendees for being here and your wonderful questions. It's a great program. Thank you.
Here we go. On that note, I want to say bye, everybody.
Have a happy Thanksgiving.
Weekend. Yeah, happy Thanksgiving, everybody.
Yes.
And everyone stay safe and all the best to you and your flock. Till next time.
Thank you. Bye-bye.
Bye.